Next session, it is again on the HER2 positive early breast cancer. So how it is being improved in a near setting, and to deliver the talk, we have none other our dear colleague, Dr. Bipinesh Sansar. So he is a consultant from TMH Varanasi. So over to Dr. Bipinesh. You can share your screen.
Yeah. Uh, Please share the slides, team.
Yeah, your voice is slightly low.
Please share the slides. I had requested them to. Yeah.
Yeah, it's done.
Thank you. Yeah. So thank you, Dr. Amit. So is my voice clear now?
Yeah, it's okay. Yeah.
Yeah. So the topic for my talk is transforming the journey of HER2 positive early breast cancer patients. Next slide, please. Yeah, this is by Roche. Next slide, please. Yeah. So this is a brief overview of treatment for HER2 positive early breast cancer. So if it is tumor is more than 2 centimeter or node positive, then definitely neoadjuvant chemotherapy with combination of pertuzumab and trastuzumab is recommended for 4 to 6 cycles. And if it is less than that, CT1C and less, then upfront surgery can be preferred. So after and all this should be the decision should be made in a multidisciplinary tumor board, including the surgical team, radiation team, and other person involved in the care of cancer patient. And so, if we are giving anesthesia and after that surgery, there is pathological complete response. Then adjuvant same pertuzumab and trastuzumab based regimen is completed for 18 cycles. And if it is residual disease after surgery, despite neoadjuvant chemotherapy, then TDM1 should be utilized. And if it is upfront surgery, then based on the if there is only uh, if there is no other factors, then only paclitaxel and trastuzumab can be given. And if it is node positive, then pertuzumab trastuzumab based regimen should be used. Next slide, please. Yeah, so we know that the infusion of pertuzumab and trastuzumab is required for a longer period of time, and so it takes time and it can be challenging to the healthcare system and patients because of the long infusion or absorption time. So even though it is only 30 to 60 minutes, but still observation and waiting for that, and if there is any hypersensitivity, it should be given about 90 minutes. So preparation time and all this takes time and placement and maintenance of indwelling venous access. So ideally, it is recommended that indwelling venous access has to be kept for EG access to lines. And also, again, the dressing for the same takes time and the risk of thrombosis and discomfort. And also, while venous access in those without any venous access device is difficult, and it takes every time the same challenge. Next slide, please. Yeah, so FESCO is the subcutaneous formulation, the first formulation in oncology to combine two monoclonal antibodies, pertuzumab and trastuzumab, in one vial for subcutaneous injection. And it contains the same antibodies as approved for IV pertuzumab and trastuzumab, only the route of administration different. And it is formulated with RHU-PH20, that is recombinant human hyaluronidase, to allow subcutaneous injection of higher drug volumes. Around 50 ml of 15 ml of loading dose can be given and 10 ml of maintenance dose can be given. And it's a ready to use fixed dose formulation and it can be given subcutaneously over approximately 5 to 8 minutes. Next slide, please. Yeah, so we know the mechanism of action. So pertuzumab and trastuzumab, we all are aware how it works in the against HER2. And the different thing here is hyaluronidase. So it's some endoglycosidase used to increase dispersion and absorption of co-administered drugs when administered subcutaneously. And it allows subcutaneous delivery of larger drug volumes, depolymerizing hyaluronate based on preclinical studies and increase the permeability of subcutaneous tissue. And also the effects of this are reversible and the permeability is restored only for 24 to 48 hours. Next slide, please. Yeah, so it showed non-inferior pharmacokinetics versus pertuzumab plus trastuzumab IV. So the FESCO combination was non-inferior to pertuzumab plus trastuzumab based on cycle 7 pre-dose of cycle 8 serum trough concentrations, and the PCR rate achieved with FESCO 60% was nearly identical of that with IV of pertuzumab and trastuzumab, which is around same 60%. And the safety profile was comparable. There were no new safety signals identified. Next slide, please. So the important things becomes the logistics. So time, cost, and resource savings. So we'll see the same with Fesco versus IV Trash 2 plus per 2. Next slide, please. Yeah. So in uh, this study, the phase 3 study of time and resource utilized with Fesco, so patients with operable or locally advanced HER2 positive, node positive early breast cancer with PCR after neoadjuvant trastuzumab based therapy and surgery were randomized to either IV arm or subcutaneous arm, and the same was continued till the required time period of 18 cycles. The primary objective was time savings for patients and healthcare professionals with cycles 5 to 7 versus trastuzumab plus perso IV or with in the compared cycles 2 to 4. And secondary objectives were resource utilization reduction and safety and tolerability. Next slide, please. Yeah, so the FESCO treatment resulted in significant time savings for both patients and healthcare professionals compared to the IV treatment. And the use of several medical consumables were reduced with FESCO compared to the IV study. And the drug waste seen with reconstruction was also avoided because this is a uh, uh, pre, uh, pre-packed combination. And preliminary safety data indicated that each treatment were well tolerated and consistent with known safety profiles. And for dual HER2 blockade, the advantages gained from subcutaneous versus IV administration in addition to the fixed dose combination versus separate administration of each drug. And taken together, they support the preference for FESCO use in patients in which the use of both trastuzumab and pertuzumab is required. Next slide, please. Again, we have Indian real-world evidence studies on the efficacy and satisfaction among HER2 positive breast cancer patients, uh, uh, led by Shunanang ma'am. Next slide, please. Yeah, so again, we can see that although small study, but patients with differently both ER hormone negative and hormone positive HER2 positive patient were there, and patients up with upfront surgery and adjuvant and metastatic, all type of patients were covered. Next slide, please. So again, the pathological complete response is quite high, you can see around 80%. And again, PCR in astro with ER accepted positivity, again, it is as per the standard what we found with uh, IV combinations. Next slide, please. Again, the most important factor, the satisfaction rate, so it is 92% with the subcutaneous rate because there is no, only hardly a few patients have some local reactions. And the reason for satisfaction for most of them, most important was time saving, less pain and discomfort, and reduced hospital visit. So the there was time saved, and obviously patients want to spend less time in hospital and more time at home or doing their own work, and discomfort is also less with this one compared to IV. And some patients felt anxiety, but it was not very high. And cost effectiveness is definitely cost effectiveness uh, not be compared much with this. And the patient preference, so final patient preference was subcutaneous 92% compared to IV. So definitely, if all the factors are taken care of, patients would prefer subcutaneous formulation compared to IV. Next slide, please. Yeah, so to summarize, it provides benefits in cost, time, and reduction of patient and healthcare professional burden. Shorter times, 5 to 8 minutes, and ablution period of 15 to 30 minutes. Reduces burden on everyone. Less invasive administration, single subcutaneous injection compared to two separate IV injections. Fixed dose formulation helps to reduce dosing errors and reduces drug wastage, and it is beneficial for nursing and pharmacy staff also. And reduced time required will helps the center to save time, and there are no new safety signals. Next slide, please. Yeah, so thank you. So definitely this helps the patients plan their treatment and carry out with less administrative.